So if you look at how HR has progressed, we've kind of swung on this crazy pendulum over the last 50, 60 years. We started off being personnel, and then we had to deal with the unions, and then we had to start doing recruitment, and then we had to start doing all of these other things. And we've added and added and added and added and added. And yeah, a lot of times HR people tell me they're just exhausted because you've got to be able to do marketing, you've got to be able to do recruitment, you've got to be able to do all of these things. And we're always told that we have to be business partners. If you look at all of the models for HR, it's how do you be a better business partner? How do you understand the business?
Mm-hmm.
And the conclusion I came to is that I think as a profession, we've moved too far on that business partnering thing, and we kind of forgot about the people. And this is why I'm saying it has to be a duality, not a paradox. It's not either or, it has to be both.
Hi everyone, welcome back to the HR Leaders Podcast. On today's episode, I'm joined by Angela Ryan, who's the Group Chief HR Officer at IHH Healthcare. During the episode, Angela shares the crucial role HR plays in urgent care, the evolving role of the HR function, and why you should see people and the organisation as a duality and not a paradox. As always, before we jump into the video, make sure you hit the subscribe button, turn on the notification bell, and follow on your favourite podcast platform so you never miss out. With that being said, let's jump in. Angela, welcome to the show. How are you?
I'm very well, thank you. And thank you for inviting me to join you on the show.
No, Happy New Year. Happy New Year. How was the holidays?
Holidays were lovely. I think one of the benefits in living in Asia is you get beautiful places to travel to. Lots of sunshine.
The opposite, literally everything the opposite of us in the UK as well. But you're coming back though soon though, so we'll see you soon.
Yeah, coming back for a short family visit.
Nice. I love your background, by the way.
Looking forward to the weather.
I love your background, by the way, taking the opportunity to share the brand, the why, the values, the purpose.
Yeah, there's a little bit about IHH and the values that we've crystallised and built on over the last few years.
And for those that are just listening, it says patients first, integrity, empathy, teamwork, and excellence, just for those that are audio only as well. Before we jump in, tell everyone a little bit more about you personally and your journey to where we are now.
So as you can tell from my accent, I am English, of course. So I grew up in the UK, was educated in the UK, but I'd always wanted to work internationally. So after a start in a different profession, I ended up in human resources. I did about 10 years in the UK. And then I got the opportunity to start working internationally and I moved to Asia. And so I've been based out of Singapore for 17 years now.
Wow.
From an HR perspective, I've done a mixture of markets, regional, global roles, generalist BPs and centres of excellence that have kind of taken me to this point here in 2023, where I'm the Group Chief HR Officer for a company called IHH.
Amazing. Tell everyone a little bit more about the company, just in case they're not aware.
Yeah, sure. So IHH is one of the world's largest healthcare networks. So what that means in effect is we have 82 hospitals in around 10 countries around the world and a lot of other types of medical services such as laboratories and GP clinics, for example. So we have around 67,000 employees.
Wow.
Those are all healthcare practitioners. And what we're all about is providing patient-centered quality care.
Mm-hmm.
And we have this mantra that we work with, which is around touching lives and transforming care. And it's really all about our people and how they serve our patients.
Wow. It must have been a bit of a whirlwind then during the pandemic for you and the team.
That is the understatement.
Yeah. That's true, yeah.
So I'd spent 20 years of my career working in media and entertainment. I got to this point where I wanted to carry on in HR, but I wanted to try something different. So I decided it was a good opportunity to change industries. And in 2019, in September 2019, I joined IHH. So I was new to healthcare, certainly new to the hospital groups. And then literally within about 8 weeks, we started having reports of what became COVID.
Wow. So you were literally thrown in at the deep end.
It was... Yes, I think the deep end is the understatement of the year.
Yeah. How do you, I don't know, where did you even begin at that point? Because normally, when you first join a company, you kind of have the opportunity to go on, a listing tour, let's say, of the business, right? Get to understand the organisation, get to understand the leaders, and then kind of create a strategy. But did you kind of have to change that and kind of more react more immediately than you would?
Yeah. So I joined in September, and I managed in the first couple of months, really between mid-September when I joined to the end of the year, to do some of that thing. So to obviously meet and engage with our board, and certainly with our nomination and remuneration committee and that piece of it, to go to quite a number of our markets, and for me to really start understanding what it means to work in healthcare, because obviously coming with an HR background and from a very different industry, my first approach was really, I need to understand what it means to be a nurse. So I did get some opportunities to do that, but then of course, the world shifts on its axes, and then all of a sudden we're dealing with obviously what evolved into the pandemic. What I can say is, if you ever want to be in a crisis, work with doctors.
Yeah.
Nobody panicked. And I think I would look around the room and nobody really was panicking. And so that gave me the confidence that for me to keep going and carry on with what I needed to do. And I think, for me, it's probably been the most pivotal moment in my career. Because I think, we often talk about purpose and we talk about meaning. And certainly as HR practitioners, we often talk about how we have to inculcate that into organizations and industries, don't we? But I tell you, when you're in the middle of a pandemic, your purpose crystallizes. And for me, it was very, very clear. My job, my reason for being there was to care for our people so that they could care for our patients, full stop. So for that period, over that time, because of course hospitals didn't close.
Yeah,
we weren't in a position where we were moving into pivoting into agile-based working or anything like that. So it was really about stripping everything back. So we didn't bother with performance management. We didn't bother with any of the typical HR stuff. It was all about, are our people safe? Do we have protocols in place? Do they have enough PEP? I had to learn a lot of new jargon over those first couple of months.
I bet.
And, we did have to deal with the reality of ensuring that we had sufficient death in service benefits. We, like many healthcare organizations, certainly in those first few months before vaccinations were created, we did lose people, particularly nurses in ICU, who were there treating their patients.
Yeah. What would you say you learned about yourself during that time?
What did I learn about myself? I've always said that I was, that I hope to be someone who took their job seriously, but not themselves. And I think that really embedded for me during that time, because, when you are, you might have a C-suite job title, but at the end of the day, it is the people in the hospitals who are making the difference.
Yeah.
And so it was very much turned into, how could I be of service to these 65,000 people that we had around the world? And that was it.
Yeah.
Which I know sounds a bit frou-frou, but actually,
no, it doesn't at all.
As I said, it was probably a pivotal moment for me.
Yeah, it was a perfect demonstration of, people first and servant leadership.
Yeah.
If you want to put it that way. So definitely what was needed, required, as well. So from where you were there to kind of fast track to where we are now, how have things changed?
Yeah. So from that perspective, obviously, with a lot of countries around the world, we've moved from pandemic status to endemic status. China, as you may know, has now starting to open borders again. So we are seeing more international travel. We're seeing more patients now coming back for elective treatments. So what happened over the course of the pandemic was, obviously our hospitals were treating, in many countries, we were partnering with local governments to treat COVID patients. And it meant that a lot of patients weren't coming in for elective treatments.
Yeah.
So we have been extraordinarily busy over the last 2 years. We foresee this year will be as well, because the patients are coming back.
Really? So almost playing catch up where people weren't coming in for so long.
Yeah.
Now they're all coming in.
Yes.
As well. Yeah.
Yeah. So those patients who had conditions that they could delay for clinical reasons for that period of time are now coming back, and then you have the usual accidents and emergencies and everything else to contend with.
It's great. It's funny you say that, because my daughter was ill recently, and we went to the hospital, and the line was coming out the door into the street, and I've never seen that in my entire life. I literally was in shock, and I walked into the front, said to they had a security guard because they was trying to stop people from coming in, and I was like, what's happening? And he was like, it's just so busy, and there's people like mums with their babies and stuff waiting in like a line in the street. I couldn't believe it.
Yeah, I think, it's certainly as I look at the UK, obviously from my position here being in Singapore and also looking at industry and looking at NHS, I can see the incredible strain that the NHS is under.
Yeah.
And certainly over the last few weeks, we've been hearing reports, obviously, of nurses going on strikes, and there's potential that junior doctors will as well. And, what I can say, and of course, look, I'm not a nurse and I'm not a doctor, but what I can say for so many of the nursing and doctors that I've met over the last few years, they go into that profession as a vocation. So for a nurse to stand back and say, I'm not going to treat my patients, I'm going to go on strike, then that really shows you the breaking point that system is getting to.
Yeah, exactly. And I called a few of my friends who are doctors. I was like, just in case this is like a one-off. And they were like, no, like this is all like this all over the UK.
Yeah.
And I was like, wow, I don't really talking about this enough. I don't think people even realise it's that bad at the moment. So I hope we can figure it out. When we last spoke, you mentioned around like why you should never go into the basement of a medical university. So talk to lighten the mood a little bit.
That's a little bit of a lighter.
I thought I'd switch gears and lighten the mood a little bit to tell that story to the audience.
We've gone to death and destruction to, so I joined in September, as I mentioned. I did the first 3 months of the last quarter of 2019. So I had to write my end of year sort of mini appraisal for my boss, who's the CEO. And it got to the point in the form and it said, what are you most proud of in the last 3 months? And my comment was not throwing up in the mortuary.
Oh my God.
What happened was, I'm going on the visits, and in our business in Turkey, we have probably one of the best medical universities in the world. It's one that's globally renowned. And so I'm bright-eyed and bushy-tailed, and I'm walking around going, oh, this is really interesting, and oh, doctors and all this. And you start at the top of the building, and like in a hospital, you go down and down and down and down and down. I didn't realize, of course, that in that basement floor, I walked into this area, and there was cadavers floating in fluid in these big glass tanks, and there was these medical students.
Oh, so when they were learning, basically. They
were learning, and they were performing incisions on the gurney in front of me, and I was standing there with the doctors trying to nod very wisely and go, this is really interesting. Yeah, and then trying to walk really, really fast out of the room and not throw up.
They didn't prepare you for that? They didn't give you a heads up?
No.
That's pretty crazy.
Doctors are really
they're so immune to it, right? They're so like numb to it. They're like, yeah. Wow.
Absolutely. I mean, the dinner conversations that I have these days are frankly hilarious.
Yeah, because they see everything, don't they, day in, day out.
That it's talking about robotic surgery happening, and where in the body it's happening, and you're sitting there trying to eat a steak, and you get tough quite quickly.
Yeah. It's interesting, isn't it? Because like you mentioned, which was incredible, and I saw that as well, how calm the doctors were when when I went to the hospital during the pandemic, for example. It was kind of weird because everyone else is panicking, but the doctors are just, it's another day for them to deliver, and they also need to remain calm. Because if they don't remain calm, then everyone else is going to feel even more panicked.
It is, and I think it's again, it's something to remember about people who choose these vocations. Again, one of my first observations coming in from a very different industry was, in any other world, if someone went through that amount of stress and pressure in a day, so for example, your patient dies, in any other industry, we would sign them off sick and give them time out and everything else. But actually what happens, and I see it happen, especially our nurses, they come back in the next morning for the next shift, the smile is back on their face, they're there to serve their patients. But I think sometimes we make the mistake of describing them as superhuman. They're not. They are, I think heroes, absolutely, I'm the first person to applaud them, but they are human beings. And, and that was a key point for us over the last couple of years, is that remembering they were human beings first and putting their well-being, their mental, their emotional well-being, as well as obviously financial and everything else, had to be at the heart of what we were doing for them, because they were doing so much for the rest of us.
Yeah, we take that for granted, right?
Yeah.
Forget about that. What now? How long have you been there now? Is it 2 years, you say, or longer than
3 years?
3 years.
Yeah, I've done 3.5 years so far.
After being there 3.5 years, what advice would you give to other HR professionals that are considering switching to the healthcare industry?
Oh, do it. I had 20 years in an industry I loved. There was, I had such fun working in media and advertising, and it was brilliant. But for me personally, coming into healthcare, as I've been able to crystallize more of a sense of real purpose of what I do and why I do it. And I think for anyone else who's considering coming into this industry, like every industry, there are challenges, but actually the level of rewards you can get from on an intrinsic level is really quite profound.
Yeah.
But it is an industry that at the moment doesn't tend to attract great HR practitioners.
Really?
I think it's because a lot of the it's an industry that's never really invested in HR, not to the degree that other industries like tech or
yeah, I was going to ask you that. Where are you on that curve? We've seen significant transformation, HR, especially in the last couple of years, right? It's kind of leapfrogged 5 years into the future. Talk about the future of HR. The future is now. We're in it. We're living it.
Yeah.
How is that in the healthcare industry?
Healthcare is not there yet. It's definitely not at the level of some other multinational industries and the like. I mean, certainly on some of the things around what we would consider core HR, even something as simple as performance management. Well, actually, most doctors and nurses have never been taught how to do any of this. So if you don't have your strong foundations in place, it's not part of clinical practice.
Interesting.
Most doctors, go to school, go to university, go straight into a hospital. So unless they've had exposure to some of these types of practices, they just don't have the foundations. And so typically it hasn't necessarily attracted some types of HR practitioners to come in, which actually for me was the real point of interest in joining. Because the brief I got was to come in and help IHH move the HR practice area forward so that we could help to build the business.
Mm-hmm. Is it? I think maybe I'm wrong, but I'm sure I've heard in the past when I speak to HR leaders around healthcare, they've kind of described it as quite hard to make significant change. There's a lot of red tape, especially when you talk about the, NHS, for example. It's a monumental task of really impacting and making change.
So I think there's two things. I think firstly, obviously, it depends on the organisation you're working for. I mean, the NHS is such a huge monolith of an organisation that absolutely, it's like turning the Titanic, isn't it? Well, hopefully it's not going to sink, but it's so large that of course anything would change time. But I think more generally as an industry, though, if you think about how medicine has evolved, it's all evidence-based. Mm-hmm. So everything that we do in healthcare is evidence-based. It has years of research behind it. The big change has been, because of the pandemic, was how quickly vaccines got to market. Mm-hmm. Previously, it's taken years. So when you're coming in and you're dealing with doctors and nurses, actually what they want to see is the evidence for what you're trying to do. And that's why sometimes change can take a little bit longer. Yeah,
because it has to be. It's kind of part of the process, right? Of working in that industry. So what are the key focus areas for you then over the next 12 to 18 months for you and the team?
The biggest problem we have to solve, and it's not just us, is the global shortage now of healthcare practitioners. So the World Health Organization are now stating that by 2030, as an industry, we're going to be somewhere in the region of 8 or 9 million practitioners short.
Really?
Yeah. Wow. So what's happening is not enough people are coming into healthcare. And also, as a result of the pandemic, people have decided to leave the industry.
Oh, so it's not
the challenge, of course, that we have, the challenge there is that these types of skill sets and practitioners, you can't build in a year. Yeah, it takes multiple years of study and education and experience to become a registered nurse, for example. So there's not the quick wins in this profession that you have sometimes in other industries where you can find certain skill sets and then retrain. So I think as an industry, we need to be encouraging more people to come into healthcare. Yeah, talking to 16 and 17-year-olds as they started making their decisions for A levels in the UK. Yeah, encouraging them that. Yeah, I was hopeful after the pandemic that more people would come into nursing. I think because it showed the profession in such a positive way, but actually the nursing colleges are reporting a drop in applications.
I was thinking that as well, because people could have took it two ways. One, they could have been inspired and, like you mentioned, like your point, or the other, they could have been like, oh, wow, that's really tough. I can't believe what they had to go through. I don't want to go through that and be a nurse.
Yeah. And I think, and I think that certainly is part of the implications that we're seeing. So for us, firstly, we need to get more people into the industry. And then, of course, as IHH, we want people to choose IHH as the place they want to work if they want to work in private healthcare. But this whole point of, how do you manage that? Because if you think about it, we're in this really interesting tipping point at the moment as we go into this year, because we've got this duality happening right now of potential recessions and talent shortages at the same time.
Yeah.
And so as a business, you have to think about how you manage that. And you've got to be quite different, and you've got to be decisive. And as we saw over the last couple of years, a lot of the textbook HR approaches on things just aren't best fit anymore.
Yeah. How do you feel?
So we're working on that.
How do you feel like you're faring in terms of a brand and people knowing about who you are versus the competition?
So we operate across 10 different countries, and we have different brands in each of our markets.
Oh, really? Okay.
So they're all owned by IHH, but for example, our home markets are Malaysia, Singapore, India, and Turkey. And we do have market leading brands in those countries. But again, just being the market leader doesn't help you when there's just not enough healthcare practitioners to fill all of the roles that are available, and new hospitals are always opening, so there's even more competition.
Yeah. So what are we doing to combat that? Because I was thinking about while you're saying that, like when I grew up, there was a lot of like friends, family members who were doctors, nurses. Even my generation, there were a lot of interest in being a doctor or a nurse. But the next generation down, you're right. I don't know anyone who's like, I can't even name a person I know in my whole network or my friends' networks who actually are interested in pursuing the profession. What are governments and organisations doing about this?
So I think there is something that, as organisations, we do need to partner with governments and with the medical boards to really help drive and focus on raising the profile of careers in the industry. Because obviously, if you do want to become a doctor or nurse, you have to make that decision very early on in your life.
Yes.
Yeah, you've got to be making those decisions at 14, really, when you decide your GCSEs.
Wow.
If you think about it, you've got to do all the sciences. Then at A level, you need to be doing biology and sciences. Yeah, you've got to be, you either have to know what you want to do at that young age, or you go through what some people do. They go through their first career and then they go back into retraining. But it comes back to that point of course, it takes years to work through that. So I think governments, we do need to be talking more about opportunities and about what it means. I think, in some countries around the world, though, certainly with nurses, they're not necessarily always given the respect and admiration that they deserve as a career choice.
Yeah.
Doctors, it's a lot easier to be honest, to get doctors.
It's true. I think one of the other decisions when I speak to I've got two friends that are doctors, and they're always talking about the financial implication of becoming a doctor too, the debt. And I think that's something maybe we could talk about. I mean, as governments, organisations to help there, because that's one of the big commitments. Many people don't pursue it because they're like, well, I'm going to spend the next 20, 30 years,
7 years,
paying off hundreds of thousands of pounds of debt.
Yeah, and as you'll have seen in the news over the last couple of days, when because I think salary information is obviously on the news because they're what the junior doctors are earning. Yeah, there are. I think the point is this: if you are smart enough to become a doctor, and let's be honest, to become a doctor, you need to be academically at the top. If you're smart enough to do that, you're also smart enough to pursue a number of other careers.
Yes.
So you have that choice. And so, as you say, you could potentially look at it if medicine isn't a vocation for you, you can look at it and go, well, I could go into banking, I could go into industry, I could do it on a 3 to 4 year degree, and I could be earning £100,000 within a few years. Versus I'm going to go into medicine, 7 years training at least, then pursue through the NHS and do it that way. So we have to give people the reason.
Yeah. It's interesting because what you're saying, a lot of being a HR leader in healthcare, like, it's not for the faint of heart as well then, right? Because it's, if it is really has to be aligned with your passion and your purpose. And like you have on the screen right now, you need to have integrity, empathy, patient first, teamwork, excellence. They are the cornerstones and pillars of what it means. So I can understand why you're so passionate and energized to be in the industry as well.
Yeah, and it is. I think I joined at a brilliant point in time where we had a new CEO joining, and before the pandemic started, we had those few months to really set out what his vision was for the organisation, and then from that we were able to start distilling, for example, what the values were going to look like. We have a very clear proposition that is around care for good. And also this understanding about that we want to be the world's most trusted healthcare services, network services. And so a lot of that is spent in understanding what does it mean to work for that organization? And then how do we ensure that everybody who chooses to work for us has an experience that reflects what we're trying to do? And I think that's why these values have really kicked in.
Yeah. You mentioned when we first spoke as well about duality, not paradox, of people versus organizations. Could you elaborate on that for our listeners?
So I think this has been, again, one of those kind of aha moments in my own development as a practitioner. I came up through quite a traditional HR route. I'm a fellow of the CIPD, and I have a lot of time and respect for our professional body. And I've also, certainly over the last couple of years, had a lot of opportunity to work with a lot of thought leaders within HR, including, for example, Prof. Ulrich, who designed the modern HR practice as we know it. And I've had a lot of discussions with people over the years around this point of what is our purpose as HR? So if you look at how HR has progressed, we've kind of swung on this crazy pendulum over the last 50, 60 years. We started off being personnel, and then we had to deal with the unions, and then we had to start doing recruitment, and then we had to start doing all of these other things, and we've added and added and added and added and added. And a lot of times HR people tell me they're just exhausted because you've got to be able to do marketing, you've got to be able to do recruitment, you've got to be able to do all of these things. And we're always told that we have to be business partners. If you look at all of the models for HR, it's how do you be a better business partner? How do you understand the business? And the conclusion I came to is that I think as a profession, we've moved too far on that business partnering thing, and we kind of forgot about the people. And when we come into difficult scenarios, and this is why I'm saying it has to be a duality, not a paradox. It's not either or, it has to be both.
Yeah.
And so how do you bring, I make a lot of jokes with my own team about, we need to bring the human back into human resources.
I think I completely agree with you, by the way. And I when I started at 17, it was personnel, by the way. I remember those days. I remember those days. Personnel relations. I feel like we saw that play out during the pandemic. Those companies that were truly people first really did well, during it, and to support their people and be there. And others that were spent the last 5+ years, purely on the business partnering side, really struggled. As well. And I saw both sides. So I was literally having conversations every single day. But as you said, it can't be one or the other.
No.
It has to be both.
the phrase that winds me up more than anything is when I see a company say, people are our greatest asset. Because without fail, most of those organizations, when things get tough, treat people as an expense.
They treat them as an asset.
No, they treat them as
an expense. Oh, right. Okay, they got the opposite direction.
Because this is all the accounting terms, isn't it? Some bright spark in accounting came up with this idea that people are an asset because they wanted to find a way to capture the monetary value of knowledge workers. So they said people are our greatest asset, but then we treat them as an expense.
Yeah.
So when times get difficult, we look at cost savings, don't we? We look at redundancies. We look at all of these things. So we tell people one thing and then we treat them as another.
Yeah,
and I think we
people
really
see
have
that
to
as well.
reframe that.
Yeah, and people saw that and they won't forget that. Those people that work for all those organizations will never forget that. I had friends and family members come to me saying, I can't believe, the response I'm getting from HR, from the business, from my manager, etc. during this time. And then they're saying, oh, actually, we want you all to come back now.
You're like, no, thanks.
No, yeah, exactly. And that's why we saw this mass move of people moving around, right? People that I never thought would ever leave their company that, were like, what's that saying? It's something along the lines of, it's not what you say, but they'll remember how you made them feel.
How to make you feel. Yeah, absolutely.
Yeah. And that's so true.
I think people have long memories for the emotions that are created.
Yeah.
And I think if you treat people in a shoddy way, then your brand as an organization is inherently damaged, isn't it? And also it's coming back to the values behind it. You've got to have integrity. You've got to have empathy. When you have to make those difficult decisions and have those difficult discussions, you can do it in a kind way.
Yeah, exactly.
In a respectful way.
Yeah, sometimes you have to do it. Sometimes you have to do it, but do it in the right way, like you're saying.
That's why I'm saying it's a duality, not a paradox.
Yeah, no, I love it. It's important you brought that up. And I realized I was kind of in that position with my team because we lost 90% of our revenue during the pandemic because we did face-to-face events. And I was literally, we had about 3 months runway left before we ran out of money. So it was tough. I was sitting down with Shane and my founder and we're like, what do we do? We're 3 months away from literally having no money left. And it was one of those moments where I was sort of battling with my heart and my head, and we ended up letting the team make the decision. So we sat down with the team and said, look, we can either furlough everyone and wait it out, but we're not sure how long this is going to go on for. No one did, but this is when people thought it would be a few months. Or we've got 3 months of runway, literally, I've just been very honest with them, to come up with a new product and sell it in 3 months, which is not a lot of time to develop a product, sell it, and become profitable. And the team was like, let's do it, let's do that. We don't want to wait around and hope. And we actually quadrupled our revenue in 3 months and started doing the global virtual summits, the online stuff, and we just massively scaled the company. But it was one of those moments where, managed me and Shay were like, oh, we don't, probably I should let people go and batten down the hatches, which is what every single person around us did. Every single company in our industry did that. But the team were like, no, we don't want to leave it in the hands of, we'd rather leave it in our own hands and say, at least we gave it a go, as opposed to waiting it out. And if we did, and we now know, if we would have waited out, we wouldn't have had a company. Because we would no way we would have survived for 2 years as well. So that was kind of, and the reason I say that is now the team, because we believed in them and they saw that, they go above and beyond. They support each other. They're there for me and Shane. The good times and the bad times, they rise to the occasion because we demonstrated to them that we care about them, to your point as well.
Yeah. So what I'm taking out of what you've just described, and I think it's phenomenal, I think you treated them with respect and you treated them as adults and included them in those discussions, and one of the outcomes of that is that you built trust.
Yeah. And
without trust, you can't have relationships of any type, can you? I mean, it's and certainly employees need to be able to trust that the organization will do its best for them even in those difficult times.
And also, it was their ideas that got us out of it.
Yeah.
It wasn't mine and Shane's. It was sitting down with the team saying, all right, any ideas, bring them to the table. And it was the ideas that they come up with, which kept the business going as well. And then they got to then bring their ideas to life, right? Which is so empowering for them, right? They're not just saying, oh, this is our idea, go and do it. They're like, we're doing it, you know? So yeah, it's so interesting.
But it takes confidence as a leader to be able to do that.
I wish I could say I felt that way at the time.
No, but you know what I mean? I think it's because, yeah, if you think about models and concepts of what a leader is supposed to be, leaders are supposed to have all the answers. And, for many people in that position, when they don't have the answers, it can be quite difficult for them to invite answers and suggestions and solutions from other people, certainly if they're more junior to them in the hierarchy of whatever organization it is.
Yeah, I can tell you right now, like that month, those months, like I didn't sleep once because I didn't have the answer, and I felt so pressured. Like I should have the answer. I'm the CEO. I'm the founder. I should have the answer, and I didn't. And it was really hard to walk in a room with a team and say, I don't know, because they were looking at me, asking, literally like, what are we going to do? And I'm like, I don't know, but we're going to figure it out together. That's all I had. That's all. I was like, I could lie to them and pretend that, or I could just say, I don't know, but let's figure it out. And that's what happened. It was tough. It was really tough to do that. So I felt like I let them down, but then I realized actually everyone here, we're all in this together. It's not just me. Just because I'm the founder and CEO doesn't mean I have to always have the answers as well. But listen, before I let you go, I want to jump into our quick fire round. So I do this with every guest. So you've got no longer than 30 seconds for each answer. You ready?
Oh gosh, okay.
No pressure. What are your hobbies and passions outside of the office?
Living in the sunshine, my passions are all outdoors. So I've just come back from a week scuba diving.
Nice. That's why you.
Scuba diving, water sailing.
That's why you never came back to the UK.
That's why I left the UK.
You can't go scuba diving in the UK.
You can, but it's blooming cold.
If you click your fingers and change one thing about HR, what would you change?
Strength of identity in the profession and stop apologising for our existence.
Yeah, love that one. How would your friends and family describe what you do for a living?
You see, I asked my children what they think I do. One of them said that I listen to people, I try to make it better, but if they're rubbish, I fire them. And the other one just said, Mum, don't you just fire lots of people? And I was like, I don't know what conversations I've been having at home.
It's so funny what the kids pick up. Talking of your kids, kind of what legacy do you want to leave behind for your family?
Well, I plan to spend all my money scuba diving once I retire. So I hope, though, that I've left my kids with the understanding. We talk about being brave hearts, brave but kind.
Live life to
on
the
those
full.
bases, though, I think that'd be good.
Love that. Have you ever considered another profession? If so, why?
So I started out in law before I ended up in HR.
Oh, really?
I also had the opportunity in a previous organisation to move into a business role. So I was COO for a while. And I had the opportunity then to pursue a CEO track. But I came back into HR because I love the work that we get to do.
Amazing. What's the biggest investment you've made in yourself?
Doing a doctorate.
Nice.
I think it's, I've done a lot of the typical HR practitioner programs, business schools, but actually the doctorate taught me to challenge my own thinking. And that's quite humbling.
Yeah. It's hard to look yourself in the mirror. Who's the person in your career that's had the biggest impact on you?
I've been lucky enough, I've had two mentors. The second mentor is actually the CEO I just mentioned, who encouraged me to look at other types of careers before being able to make that choice to stay in HR. And he had confidence in me that I didn't feel in myself at that time.
What's his name? We'll give him a shout out.
His name's Mark Patterson.
Nice.
So he's now global COO for a company called GroupM, which is part of WPP.
Nice, amazing. And then last question, what's one piece of advice you would give to your peers who will be sitting in your seat one day? Those HR leaders of the future.
Be clear on what you stand for and your own identity. I think the role of HR can be really amorphous. So one, I think be really clear about your branding and your positioning as an HR practitioner. My second piece of advice, and I've just learnt this over the years, you pick a CEO, you don't pick an organisation.
Oh, interesting.
Yeah, the role of an HR leader, so much depends on the CEO that you're working for. You know, you can get boxed into a corner, you can get given other opportunities. Choose the right individual who has the right values that you believe in, and you can fly.
Fantastic. Well, listen, before you go, where can people connect with you if they want to reach out and say hi to you?
So you can find me on LinkedIn, Angela Ryan, based in Singapore. You can find me at Talent Ryan on Twitter, and actually all the other socials as well.
Nice. Well, I appreciate you coming on, and always jealous when I speak to you because you're always talking about the hot weather and scuba diving and you show off every time. But
well, you need to do an international tour then, don't you?
Yeah, we do. Yeah, we'll figure out a reason to come out to you. But I wish you all the best until we next speak. I appreciate you coming on.
My pleasure. Been great. Thank you.